This is a plain CT scan brain of a 1-year-old male baby. The patient is already a known case of obstructive hydrocephalus. He had a history of fall about 4 weeks ago. Please see this fracture line involving right side of the frontal bone and right superior orbital margin. There is another fracture line which has involved left parietal bone. This is the CT scan brain. There is mild dilatation of extracerebral CSF spaces. This is suggestive of cerebellar atrophy. There is moderate dilatation of both the lateral ventricles. Head is enlarged. Calvarium is thinned. There is sutural diastasis. Now please see that this is the third ventricle. This is the lower part of third ventricle. When I trace it upwards, there is an intrathalamic adhesion or massa intermedia. This is the posterior part of the third ventricle. It extends upwards in between the dilated lateral ventricles. This is suggestive of the agenesis of posterior part of body of corpus callosum and the splenium. There is an ill-defined hypodensely in here. This is suggestive of chronic infarct or encephalomyelitic pain because of the residual effects of previous cerebral contusion. Now when I trace it down, this is the aqueduct which is slightly dilated. Fourth ventricle is squeezed and is not visible. The patient had meningocele for which the patient was operated upon. Now please see this herniation of cerebellar tonsils into the upper part of the cervical spinal canal. This is the sagittal scan. This is the genome of corpus callosum, anterior part of the body of corpus callosum, although it is thinned, but posteriorly body of corpus callosum and splenium, these are not traceable. This is intrathalamic adhesion or massa intermedia. This is the aqueduct which is slightly dilated. This is the region of the fourth ventricle which is markedly narrowed. This has resulted in obstructive hydrocephalus. Please observe the herniation of cerebellar tonsils through the foramen magnum into the upper part of dilated cervical spinal canal. This is the brainstem which is displaced anteriorly.